Good afternoon, friends. I am Dr. Dipan Desai, speaking from Ahmedabad, from Diva Eye Institute. I have been asked to inform you more about glaucoma. Glaucoma is known as the silent thief at night because without having any redness, watering, or pain, the optic nerve at the back of the eye gets damaged and it causes irreversible blindness. So it is very important to understand more about glaucoma. What is glaucoma? What are the types of glaucoma? What are the risk factors? How it is diagnosed and treated? So basically, glaucoma is nothing but raised pressure in the eye. You should consider your bathroom. On one side, water is coming, and through the drain, the water is passing. Usually, the drainage system of the eye gets affected, and there is increase of tension and pressure in the eye, which causes optic atrophy, or it affects the optic nerve and causes this blindness. There are two types of glaucoma. One is open angle and the other is closed angle. Between the cornea and the iris, there is this angle which is formed. This is an open angle. This is a closed angle. The open angle, as we call, is mita jamar. You do not realize and you do not have any symptoms. And you start losing vision. The peripheral side vision also starts constricting. And it is difficult. Sometimes patients don't know. Angle closure, when the angle is closed, suddenly there's an increase in pressure. There is intense pain, redness, blurry vision, and it has to be treated urgently. And usually we have to even administer bottles of mannitol, IV, and then only we are able to control it. Here, there is a use of laser. We'll get to that. Now, who is at risk? Usually, when a parent or some relative has glaucoma, you should treat yourself as a highly suspect individual. So it is hereditary. So you have to be very careful. After age 35, you must get your eyes examined annually. Everybody over 60 should get their eyes examined routinely. Now, can even other people get glaucoma? Yes, anyone can get glaucoma. It's not necessarily only hereditary. So that is why we have to be more careful. Now, how do we diagnose this? First and foremost, it is most important that you go and meet your eye doctor. He will measure the pressure in the eye. Usually, we say that 18 to 20 millimeters of mercury is normal. Beyond that is we consider as a glaucomatous eye. But it is not a simple thing. Today, we customize, we examine the patients thoroughly, and then decide whether you have glaucoma, what treatment should be given. Then we measure the pressure by applanation tonometry, which is the most important thing. That's the gold standard of measuring pressure. Third thing we do is that we see whether this angle is open or closed by putting a lens in the front with a mirror, and we examine all around the angle. If it is open, we treat accordingly, or closed, we treat accordingly. Then we measure the thickness of the cornea. Now, this is the eyeball, and this is the cornea. We measure the thickness of this because we want to customize the cornea. If it is a thick cornea, then we have to subtract the pressure that we have measured. Say it is 20, then it becomes 18. If it is thin, then we have to add. Now, if we don't do this test, sometimes it leads to mistakes. Actually the pressure is 24, we think it's 20 and we don't treat the patient. Then a very important thing is that we measure the side vision through computerized perimetry. And finally, a very important test is OCT, optical coherence tomography. What it does is in 0.1 millimeter, it takes 1,000 scans of the optic nerve and tells us how many fibers, or consider the nerve as wires, how many wires have been cut. And then accordingly, we decide on the target pressure and the medications. Now, usually there are three forms of treatment. One, we give medications. There are eye drops, which usually do take good control. There are 4 to 5 molecules that we can use. And when treatment with medical eye drops or medications fail, then we go into, and then we have lasers. Now, in lasers, there is, I told you when the angle is closed, we do a YAG laser, we make a hole in the iris. And, it's an outpatient procedure, it is done. There are SLT lasers, there are other lasers that, we only possess in Western India, known as the G6 cyclophotocoagulation laser, whereby in many refractory or difficult cases, where we give this laser without opening the eye, and we reduce the pressure in the eye. When lasers fail, medications fail, then we think of a surgery. So basically, we drain the fluid out from the eyeball outside, where it gets absorbed. The procedure is known as subscleral sclerectomy or trabeculectomy. Sometimes we need to even use implants, where you use artificial shunts. You put tubes allowing fluid to get from within the eye to control the pressure outside. And many a times you may even have to do destructive procedures, whereby this was all done to increase the drainage or outflow. Sometimes where the fluid is made, we try to destroy that area and decrease the production of the aqueous. Now, I've enumerated what is glaucoma, how to diagnose it, and how to treat it. So, my only contention or my last wish is that please, whoever has a family history, please get yourself examined routinely. Everybody over age 35 should ideally get examined annually, or over the age 60 if you're a little lax about things, and over age 60 it becomes mandatory. You must visit your eye specialist, and they will be able to guide you and prevent blindness due to irreversible blindness due to glaucoma. Today, glaucoma in our country holds the second position as the second largest cause of blindness in our country. In the world, it holds position, literally position 1. But if we are going to be careful, and if we meet our ophthalmologist, then we can be saved from this grave disease, as we call it, glaucoma, the silent thief at night. I thank Dipan for giving me this opportunity. With this, thank the organizers. Thank you very much for this opportunity. Jai Hind.